have a disclosure. My name is Sal Sclafani, and I don't treat multiple sclerosis. Okay. In keeping with the time-honored tradition of irascible and unreliable Italians, own it. We have some delays here. Dr. Salvi's not here, so he was going to give the first talk. Mark Hakey may move up. I don't know where Fabrizio is. Also, Dr. Zamboni will not join us. He broke his leg, and he's having surgery on Monday. So, he couldn't come. I tried to talk him into it, but he said no. He didn't want to be in a wheelchair. I can't understand. Yeah. So Fabrizio's here in New York, but he's not here at the meeting yet, so we'll be a little delayed. I have a few announcements to make. Firstly, we are video recording the meeting, and we will ultimately post it online. There will be recording of audio, so anybody that asks questions will have their voice recorded. So if anybody wants to be incognito, keep your mouth shut. But otherwise, all of the video will be towards the podium and towards the screen, but not towards any of you. So unless you jump the stage, like they do at rock concerts, then we'll be okay. A couple other things here. I believe Michelle had proposed. Michelle Brown, is Michelle here? Did Michelle leave already? Michelle? Well, I had heard that Michelle was proposing a happy hour after the meeting. So let's overrun the bar. The bar she proposed is in the building called Broadway 49. I've never been there. I don't know how big it is, but we may as well just overwhelm the healthy controls. Well, anyway, I want to welcome everybody here from American Access. The meeting is being sponsored by American Access, my employer. Last year we had the meeting at Downstate, and that meeting originated when Tariq Sinan emailed me and said he'd like to visit the hospital when he visited New York with his family. And in about 3 weeks, we put on an international symposium that was the first symposium in the United States. And we had people from Africa, Europe, North America lecturing. And it was quite exciting sort of debut in the United States of the intellectuality of what we were working for. And a lot of the rumors and innuendos really couldn't stand up to the reality of people coming together and exploring an idea that seemed to have merit to some of us, while to others it seemed like a criminal act. And I believe it was after that meeting that we started to have an explosion of access to treatment throughout the United States. So I guess now that we're having the second symposium, perhaps we'll have some access in the other part of North America, which does seem like that's the next logical step, I would think. Okay, so I guess I want to thank the Canadian government for ignoring the experts for the moment and pursuing this on a timeline that was more compatible with the timeline of multiple sclerosis. I have good news is that American Access and me have finally received approval for an IRB. So I don't believe we're ready for randomized prospective trials. I think we do have more work to do before we actually do that, and but nobody's listening to me anyhow, so somebody else is going to do that randomized trial before they do their first 100 patients, and hopefully it won't cause too much trouble with mistaken techniques, etc. But anyway, we have a registry, and those of you who have been treated by American Access, as soon as we get the final details of the consent, we're going to retrospectively enroll, hopefully as many of you as are willing to participate, so that we can finally start to share the information that we've learned among our group. Our group is probably the largest aggregate treating physicians in the United States. 3 or 4 of us have done, quite a number of cases that would put us up to a pretty high level simply because of the number of people that are in our group. And that was one of the reasons that I joined the company, because I thought we could get a lot more information on the clinical arena by combining a whole bunch of groups like that. But we couldn't publish anything without an IRB, because we can't publish anybody's patient information without their permission. So I got a lot of things in my head that I can't share, but except verbally, but I can't publish them. But anyhow, that's really good news, because I started applying for an IRB approval in March 2010. So it's taken almost a year and a half to get a registry. It's absurd beyond belief. Okay, so I'd like to finish here by acknowledging a few people. I'd like to acknowledge the CEO of the company, who generously supported this. We are clearly going to lose money on this, so hopefully the generosity will continue and we can do this on an annual basis. But Ray Figueroa has been very supportive of the whole concept, and it's a for-profit company that 90% of its work has nothing to do with CCSVI, so they've got a big business that they have to protect, but he had the courage to do this, and I really appreciate him. Monica Demetor, I don't know if Monica's here, and Amy Outland and Krista Etter were the executive members of our committee that put on the conference, and I don't know if any of them are here, but they really helped to put this on and help me do it so that I could still care for patients as opposed to doing this. I got to tell you, there's so many more people involved in putting this conference on. I put this conference on in 3 weeks by myself last year, but this is a much better conference. The doctor part is absolutely amazing, to a different level than last year. Last year was very anecdotal. This year has got science and really brilliant people.